I'm gonna walk in the room, provide privacy, hand hygiene. Hey, my name is Caitlin and I'll be taking care of you today. Can you verify your name and date of birth?
Christy Mayo, 3/14/70.
All right. Do you have any allergies that I need to know about?
Allergic to iodine.
Okay, so I will ensure that our kit is iodine free for you. So the doctor has ordered for a straight catheter, Foley catheter. Do you know what that is?
I do.
Okay, so just to reiterate and to clarify with you, I will take a tube and insert it directly into your bladder so that it drains your bladder into a bag, and that will help with your urinary resistance that you've been having, urinary retention, and hopefully give you some relief. Do you have any questions for me before we get started?
No, ma'am.
All right, so I'm going to take my patient and lay them in supine position, and that way I can expose the patient, obviously asking first, and I will move the covers back and I will pull the gown up and I will place the legs in dorsal recumbent position so that the vagina is exposed and it's easier to get to. Okay, then I will come over here and prepare my sterile field. Ideally, your sterile field will be big enough to open the box and to place your sterile gloves in the real world. And it would be at waist level in a medical facility to keep the sterile field sterile. Okay, so I'm gonna start by taking out my Foley kit. It's over here. And we will make this a trash bag and put it at the end of the patient's bed. Okay, so you will start with unfolding the side that is furthest away from you. And this flap allows you to open the field. It gives you a border, a 1-inch border that is not sterile, that allows you to touch to maneuver things before you become sterile. Okay, so then you open the sides, and then you open the one closest to you, and you will adjust. And you want to try not to touch, not to cross over the sterile field, because that makes it unsterile. And if at any point during the procedure that you become unsterile, you're required to get a new kit and to start over, and that is to prevent infection from getting into the patient's body and even possibly leading to sepsis. Okay, so I'm gonna pick up my sterile gloves and place them on the side, and ideally there would be enough room for the gloves and the box and the drape so that the gloves would not touch this border, but we're gonna pretend for the video. So I'm gonna take this drape and just touch the corner. Okay, and then shiny side down, and what this does is it absorbs anything that may drain onto it during the procedure. Okay, and then you would not reach over the drape because that's going to be your sterile field as well. And so you're going to come around the patient and adjust the drape to how you like it. And again, keeping your hands above your waist once you become sterile. Okay, so this is for a male, so you can trash it. And at this point is when you're going to don sterile gloves. So there's 2 flaps on the side that allow for touching that are not sterile. And what you're going to do, again, ideally you would have plenty of room that the sterile gloves nor the box would touch. You're going to take your dominant hand and you're going to glove your non-dominant hand first. So you are going to grab underneath the cuff because that part is going to be non-sterile, and place it on your hands. Okay, and then you're going to grab on top of the cuff and place it on your dominant hand. Okay, and at this point, I can touch anything on top of the glove, and I do not want to go under the cuff now because it's no longer sterile once it's touched my skin. Okay, but I can adjust my fingers to however I like. Okay, and then this is still sterile, so I can touch the inside of this. You always want to come around, out and around. You never want to cross your sterile field, and you would drop it in the trash. Okay, now you want to prepare your catheter. So you will set this to the side, ensuring that there is a 1-inch border that is not being crossed with what's sterile on the inside. So I will take this, it's not needed, so you can come around and toss it in the trash. Okay, so this is the Q-tips that will apply peri-care to your patient before inserting the catheter. So I'm going to stick this in my box. Okay, however it will go. And then this is lube, and what you would do with this is stick it. You can stick it in the tray, you can stick it in the box, pour it out, however you want to do it, and then throw the remainder in the trash. Okay, and then you're going to get ready to prepare your actual catheter. So you're going to, and again, don't cross over your box in real life. So you're going to take the catheter, and you want to keep it in the sterile field. So you want to slowly remove the catheter. Oh, you don't want that to happen. You want to wrap it around your finger as you're pulling the sheath off so that you can lay it back down in your box. Okay, and then this is trash. So you'll go around and trash. Okay, and then you will take your solution, and you will attach it to the green port on the catheter. Okay, and now your catheter is prepared to be inserted. So you will take your box and move it over to the drape. Okay, and so you will take it and dip it in lube, but before you do that, you will open your Q-tips, and I'm just going to demonstrate for the video's purposes. Open your Q-tips, and you will take the first Q-tip, and you will go to the furthest labia, and you will go down the labia cleaning it. Then you will come around and drop, and then you will go to the inside and clean it, come around and drop, and then you will take your third Q-tip and go down the center. And what this does is cleans the vagina before inserting the catheter. Okay, so this would be in the trash. Okay, so now you're going to get ready to insert the catheter. So you will, again, dip your catheter in lubricant, and you will take your non-dominant hand and squeeze open the vagina, and you will prepare to insert the catheter. You will tell your patient to bear down. They're going to feel some pressure. And making sure that this hand does not touch any part of the body is important, because this hand is still sterile. My non-dominant hand is no longer considered sterile. So I will insert it as best as you can. And when you get a flashback of urine, for a female, you will insert it another 1 to 2 inches. And for a male, you would insert it 3 to 4 inches. Okay? And then you would take your balloon, you would take your syringe, and for the video's purposes, I'm not going to do it, but you would insert the water into the catheter, which is going to form a balloon inside the patient that will keep it from coming out. And then when you're finished with that, you can unhook it. Everything is inside the patient that has to be sterile, so you no longer have to be sterile, and you're gonna give the catheter a tug to make sure that it is in place. And you will take the bag and attach it to the patient's leg and hang the actual bag on a non-movable part of the bed. Okay, so that is that concludes your inserting. And then 24 hours later, you come in and you are asked to remove the catheter. And removing the catheter is not a sterile procedure. Instead, it's just a clean procedure. So of course you would provide hand hygiene and what you need to do for that. And then when you come in and you would don regular gloves, I don't have another pair of gloves, you would take your syringe again and you would attach it to the same port that you attached it to when you were removing it. And you will pull back on the syringe to deflate the balloon that's inside the patient. And you're going to tell them to take a deep breath. They're going to feel a little bit of discomfort. So you pull back on the syringe and you get the water to drain back into the syringe. And once that happens, the balloon has been deflated and you can pull the catheter out, and you're going to observe the tip of the catheter, the tubing of the catheter. You want to make sure that it's still intact. There's no pus, blood, or drainage on the catheter tube, and make sure that everything is still intact and okay. And of course, you would take the bag and measure the output that the patient had inside the Foley bag. And then ask the patient if there's any questions that they have, and then document how the patient tolerated the procedure. Okay?